Hello, everyone, and welcome to another Spark series by Opto Research Consultancy Services, which is a podcast focused on getting insights from the experts in the field of vision and eye care. Today, we have Dr. Prema Chande, who is the principal of Lotus College of Optometry, Mumbai, who has keen interest towards community and school eye health programs. Thank you very much for joining us, Dr. Prema Chande, and congratulations for your diplomat from AAO.
Thank you. Thank you for inviting me.
So let me start with the first question. What exactly inspired your research career, and can you share some of the rewarding aspects you have experienced so far from your research?
Mostly, my research is evidence-based and largely, as you mentioned, around community work. So my earliest publications were on models of service delivery. And so basically, the goal was to deliver community eye care service. And around that, there were a lot of unanswered questions. Or before you start doing a community service, if you go in to do a situation analysis, you try to understand before you deliver service what needs to be done. So that's where the whole concept of research came in. Although my earliest understanding of research was as young as my undergraduate days, because I've seen my seniors doing research in Netralia, and that's how I learned to do research in my third and fourth academic years and so on. But largely, when you look at what I have done in the recent years, is mostly papers around community eye health. Largely, how we can improvise on service, what are the unanswered questions, how you can improve on the quality of service, and so on.
Okay.
So that's what those are the answers we are looking for when we are looking at research.
Can you share a research project which was very challenging for you, and what qualities did you acquire to overcome those obstacles in a particular project, or you can share your any aspect which you felt, okay, these are the qualities I should learn or I have learned to overcome those challenges for a research project?
I think obviously for all of us as clinicians, the biggest challenge is statistics. Okay, dealing with numbers. Those are some of the things which we really had to go back and learn. And I remember one of the things which we realized was a lacuna when we went out for doing publications was that we didn't know how to do the statistical tests and so on. And when SPSS as a software was introduced in India, I think we must have been among the earliest to go and train. Of course, we were fortunate because we were ORCS partners at the institution, and they came forward saying, can you, would you be interested in going through this? I said, if they're going to teach us SPSS, yes, we'll undergo the training. So then I remember actually sending one of my faculty members for an SPSS training, so that when she came back, because she did have a background in research, but she also was from the seniors who did those physical manual calculations, because that's exactly how we were trained back in college. And then learning how to use these softwares, and which are today so easy. Our students just learn it off a YouTube video and those kind of things. But in those days, we had to really learn. I still remember having printouts which would give you a series of commands and say, okay, get onto this software, and then this is how you plug your questions and so on. So I think that has been one of the challenges. And then, of course, trying to understand what research. So quantitative research was something which we were always, had an understanding of what numbers meant, and then so qualitative research again was some of the new things which we had to learn. But this was again reasonably early. Now every research project is a challenge because everything is so different, and I think research is like pedaling uphill. The moment you stop pedaling, you'll slip back. So I think it's it's a lifelong learning process, I would say. But those were some of the earliest things.
Thank you for that wonderful answer. So coming to the next question, like how do you approach collaboration with researchers and build successful partnership as being in community and you have collaborations with all like international and national organization? How do you really approach for collaborations?
That's a challenge again, because Lotus is not a Shankar Netralaya or an LVPI. We are not like those well-known names where these organizations reach you. We have to reach out to them. It's first trying to get a personal connection, and once you have a personal connect, then you can, write to them, convince them on concept notes, scrums. And once they are convinced with your service delivery idea, we make sure we build a research element to the data and make sure that some of our students, younger students, are also able to collect research data along with that, and so on, so that you minimize the cost, as well as you're also able to answer questions which the project didn't have in the beginning, with why people don't want to wear glasses, or something like that. What are the barriers for awareness, or how do you make this project sustainable? So what are the answers towards sustainability, and so on. So those were the kind of things. So we first look at where there is a service need, write to the NGOs, international NGOs, grant organizations, CSR bodies today, write to them, get their support for service delivery, and then build the research element around it. So the research is not the primary element. The primary element still remains service delivery for us.
So, like being in a collaborative environment, like how do you address ethical considerations in your research, especially in community as well as public health?
So, obviously, ethics. So once your research question is ready, that's just identical. So today we have a registered ethics committee for the past few years. But in the past also we have institutional report kind of a thing, which all senior faculty members, and we would sit and whether it is community service or I think there was a snag in the recording. Okay. So this ethics will still be the same way, irrespective you're collecting data from the community or from the hospital. You still need to get from the patients. You still need to get approvals, written consent, everything. Only for retrospective studies, now we have a waiver protocol where if you later choose to analyze data which has already been collected. Now with the hospital, when the patient comes in, we already have a consent signed from them that we are going to collect your data, we are going to do this, we are going to perform these tests, and you are granting us permission. So hospital data is already, patients have granted us consent when they come in. In the community, again, the fact that they have come for the service and we are running these services for them. So in the community, we don't do any invasive tests. So there we, are getting the consent of the patient orally to come in and get the test done. So that's one. In the hospital, it's already a written. And if we choose to analyze, then if I am a researcher and if I'm trying to look back, say we have a myopia clinic here and we want to go back and see something in the myopia data, right, which is already there. These are already our patients who are in the myopia clinic who have signed hospital consent to undergone. I am not contacting the patient. I just need to do it. I can apply for a waiver to my clinical experts on the ethics committee. We apply for the waiver. They will look at it and say, okay, retrospective, not interacting with the patient, you are granted waiver. So you could be granted, you could not be granted. Now that is up to the clinicians. They sign it and only then we can start analyzing the data.
That's a new perspective which I've learned. And coming to the next.
There is a part of the SOP in the ethics, this thing. We apply for a waiver. But it's as good as getting an approval, right? There's still forms to be filled. There's still, paperwork to be done and so on. Even for case studies, we do that. Because after the patient comes in only, right? You choose. So they are very particular that for your study, you're not going in for the case presentation, you're not going and toggling with the cases treatment and all. Only after the whole thing is over, you can do a case presentation as it is, and only then you will get waiver. So with the cases, it's even more challenging to get the waiver.
Coming to the next question, how do you stay updated on the research trends in your field, and what resources do you rely on in terms of research updates?
So now there is a lot more information which you can actually read is put out. In fact, if you ask me, the internet world means it's information overcrowding. In the earlier days, we would have few journals subscribed in the library, and those were like your Bibles. You would read from side to side the journal, and that's where all your learning came from. But now there is a lot of information, and most of the journals fortunately send you alerts when their new issues are out. So at least for the 5-6 journals which I like to read in optometry, I have subscribed for the alerts. And when their alerts come in, I will go and read the abstracts. If I like something, then I will find a way to get an access to the article. Most of them, of course, you will get. A lot of it is open access today, or like through IACL or through the American Academy, you have access to some journals. You just get them and then you read them. Same way, and within the faculty team, you'll have somebody who's got an RO, so you will get an IOVS, or you will, have somebody who will get a contact lens journal. So you would get, between all of us, we try to spread the memberships. So somebody will have a BCLA and somebody will have an RO. So we have access to all the journals just to maximize on research, and students also have access to it.
So coming to the last couple of questions, what advice do you have for early career researchers, and what do you wish them to know before they start their research career?
I think they need to read and read a lot. Not just read abstracts, but to read full-length articles. That's one. And start on day one. There is no time to say, I will start doing research only when I'm in the 4th year. Even as an undergraduate, my earliest paper was, my first poster was at a conference when I was in the 2nd academic year. In fact, there was a discussion at Elite School saying, do we allow second years to actually go for a national conference? So I think that was it. And now they have a lot of information access. Like for me, although I started doing research very early, my publication started very late because that understanding was not there. That just presenting in conferences, some of my best research papers have only got conference presentations. They don't even have publications. So I think that has been my biggest weakness. So I would want to tell students today, you have a lot of platforms to publish also. Doesn't matter if you're early, you don't need to target a Scopus or a PubMed journal. Start with something lower and then you could get better. Always aim for better and start as early as possible. I would think as faculty, it's good to encourage students when they are within their 3rd and 2nd academic year to start looking at small data analysis, to look at a small survey, go talk to 20 people and come back and say, what is your understanding? Today, there are so many small things which you could do with a Google form, with a WhatsApp opinion poll. I mean, I'm so amazed with the technology these kids have at their access, right? That's also kind of a research. Now, I tell them, when you want to buy a phone, you sit and do so much of research. That's also research, right? You want to know what models, what is the price band, what are the features. What are you doing? You're doing some R&D only, right? So do that. And then, of course, we still need to elevate to what true vision sciences research is. Like I was just telling you before we started, when you look at the level of research being done in some of our labs in the US, it's amazing. Not all of it translates to being equipment use or something, but some of it does come with answers. Of course, there's a lot of money involved. There is there's a lot of work in terms of research grants and things like that. They have the resources compared to us, but that doesn't mean that we don't have resources at all. We just need to know how to tap it. That's all.
Okay. So coming to my last question, like, how do you really balance your research demands with your personal life and well-being?
It's always a challenge. Usually work takes over. So there's truly no work-life balance. It's only work, work, work. But yeah, I think it's important for work culture to have a good work-life balance. I think when you're young and you don't have family commitments, do all your research. Try to do all your publications when you're in your 20s and 30s, and then by the time you reach my age, you can slow down. So there is an age for everything. In Hinduism, we have this very nice thing. It says first 25 years you learn, and then from 25 to 50 you earn, and then from 50 to 75 you return back to the community, right? So I think that's your age. Your 25 to 30 is when you can do all your research. Don't worry so much about personal life and all of it, and then start putting time in. By the time you cross an age, you need to put time. I think that's how you will achieve good work-life balance.
Thank you very much for sharing your perspectives and research knowledge, ma'am. And I hope this conversation has ignited a little spark within all the listeners. See you all in another ORCS podcast. Thank you very much.